Hi, my name is Raymond Chen, and I'll be performing the skills for Module 2, IV Push. Alright, first off, I'm going to verbalize provider order. We have furosemide 20 milligrams IV push over 2 minutes. Patient does not have any allergies. I have gathered all my supplies. Over here, we're going to start off by performing hand hygiene. We've got our medication, we've got our flushes, syringes, alcohol prep, ID band, medication. We got the IV connector attached to our mannequin as well. Okay, and we also got alcohol pads. Okay, so first off, I'm going to assess the expiration of the medication. The medication is not expired for furosemide. There's no particulate matter. All right, it's a fresh vial. Okay, we have 100 milligrams per 10 milliliters inside this single-use vial. All right, it comes out to 10 milligrams per milliliter, meaning I'll use 2 milliliters to get the 20 milligrams as provided order. The saline flush is good. It's unopened. There's no particulate matter. I'm prepping it right now. This syringe is good. This flush over here is good. I'll be only using 3 milliliters of flush for this IV connection tubing. The syringe is good as well. Okay. Next, I'm gonna prepare my IV push medication. The syringe is not expired as well. It's not opened. All right. Okay, so I'm gonna give 2 milligrams. So I'm going to, let's see, it's a new vial, pop the cap open. All right, and next I'm going to use my needle. Aseptic technique is not, it's clean. And I'm gonna draw up 2 milliliters, meaning it's gonna be 20 milligrams of furosemide as provider order. Good. Set the medication aside. I'm going to cap this. Okay. Alright, that's capped. That's good. Next, I'm going to label this medication. Alright, I'm going to write 20 milligrams of furosemide. I'm just going to write date and time that I drew this up. Alright. Alright, now it's labeled. I'm going to write it down. It's now labeled. Okay, next thing I'm going to do is make sure it's private quarters. The curtains are drawn and the patient is private. Next thing I'm going to do is going to perform hand hygiene. Alright, I'm going to verify that this is the patient. Alright, are you Miss Ellen Davis, born 9/16/1966? Okay, great, that's you. Okay, wonderful. Alright, name checks out, birthday checks out. Okay, ID band. So Miss Davis, I'll be giving you furosemide because you gained over 3 pounds in 24 hours. There's a risk for fluid retention. That's why I'm giving you furosemide, a diuretic, to get some of those fluids out. Okay. Next, I'm gonna perform hand hygiene, and I'm gonna don gloves. Okay. Hand hygiene, good. Get new gloves. Next, what I'm going to do is I'm going to assess the IV site, make sure it's not infiltrated. It's not infiltrated, there's no edema, the IV is good. Alright. Next, I'm going to get my alcohol pad and vigorously scrub the site for 15 seconds. Alright, and now let me get my flush to gently aspirate. Alright, there's blood coming out. Alright, It's patent. Wonderful. Now I'm gonna infuse 3 milliliters to flush the site. Alright, it's going very smoothly. Alright. Alright, there's no resistance when I'm giving the medication. Good. Next, I'm gonna discard of the normosaline in the receptacle. Okay. Next, I'm gonna get another alcohol pad. And then I'm gonna scrub this site for 15 seconds. Alright, 15 seconds have elapsed. Next, I'm going to take my medication, discard the sharps, and I'm going to administer furosemide over 2 minutes. Alright. Alright, 1 minute has passed, another minute. Alright, it's been a full 2 minutes. I'm going to discard this in the proper receptacle. Alright, and next I'm going to use alcohol pad to clean the site again for 15 seconds, scrubbing vigorously. I'm going to slowly flush the site with 3 milliliters of normosaline. Alright, doing it slowly, there's no resistance. Lock this up. Okay, and the site is good, there's no infiltration. Alright, discarding the syringe in the proper receptacle as well. Next, perform hand hygiene, document the medication, and we're good.